welcome to our next episode of the Hormone Café. Today we're going to do an entire episode just on vitamin D. We'll talk about what is vitamin D, how much do you need, should everybody take it, and who should get their vitamin D tested. So the important thing about vitamin D is that it actually has a lot of benefits. For example, in pregnancy, it decreases preeclampsia. It helps us prevent diabetes. It actually gives us a higher pregnancy rate if our levels are in range. There's a decreased risk of preterm birth. And then outside of fertility or pregnancy, it helps our bones and it also helps our mood and our immune function. So vitamin D is very important and it's something that you want to get tested at least every single year. And if you're deficient, you want to get it tested at least every 3 months to make sure that your levels are appropriate to support your entire reproductive system, your mood, your bone health, and your immune system. How do we get vitamin D? The best way to get vitamin D is sun exposure. And in order to get an adequate amount of vitamin D, you have to have 20 minutes of midday sun per day, which is actually kind of difficult to do because usually midday sun is giving us the highest UV rays, and that is what our body helps convert into vitamin D. However, it's hard sometimes to go in the middle of the day and just go outside and get 20 minutes of sun. It might be a little easier on the weekend, but it's also really hard during the winter. And sometimes if we have perfect application of sunscreen, our body is not going to make a lot of vitamin D at all, especially if it's blocking a vast majority of our UV rays. But if we're putting on sunscreen, but we still have some skin exposed, then we're getting enough UV in order to make some vitamin D. So it's tricky because we want to put on sunscreen to keep our skin healthy and avoid skin cancer, but then it also prevents our bodies from making a lot of vitamin D. The other way to get vitamin D is to eat some vitamin D foods, but there are not that many vitamin D foods. Mostly fatty fish, so salmon, mackerel, sardines, and then egg yolk and beef liver. That's it. Not a lot of vitamin D food. So it's really, really hard to get adequate vitamin D from food alone unless you're having a ton of salmon and sardines and egg yolk and beef liver. Plus, you're going to need some sun exposure even on top of that. There are 2 types of vitamin D, actually. So when you get your vitamin D checked, make sure your doctor is actually checking the right type. So there's one called 25-hydroxy vitamin D. This is the major circulating form. So this is the one that needs to be tested. This is made in the liver. And then there's one called 125-dihydroxy vitamin D. This is the biologically active form, but it's only tested in very, very specialized situations. This is kind of how vitamin D works. So step 1, vitamin D enters your body. It's D3 is what's produced in the skin from sun or obtained from food into our supplements. At this point, the vitamin D is inactive. So step 2 is that the liver converts this into 25-hydroxy vitamin D. This is the body's storage pool. This is what we think of as our vitamin D savings account. So it reflects our total body vitamin D stores. It's stable over weeks, and that is what we want to measure. So the lab will report it as 25-OH vitamin D. And then step 3, our kidneys then convert that into what's called 125-dihydroxy vitamin D. So the kidneys and other tissues convert our stored vitamin D into the active hormone using an enzyme. So 125 vitamin D is the biologically active form. That's what increases our calcium absorption, regulates phosphorus, influences our immune function, acts on our ovaries, acts on our endometrium. So that is the vitamin D that we're actively spending. So why don't we measure 125 vitamin D? And that's because the body actually regulates that very tightly. So even when someone is vitamin D deficient, our parathyroid hormone in our brain will rise, and then the kidneys will compensate by producing more 125 vitamin D. So as a result, our 125 vitamin D can be normal or even high in someone who's severely vitamin D deficient. So if you don't have a lot of storage, your body will compensate by using up all the storage and making a bunch of active vitamin D. So you do not want to measure 125 vitamin D. You want to measure your vitamin D stores. So you want to measure your 25-OH vitamin D. And who should get their vitamin D checked? Every person. Every single person should get their vitamin D checked. because vitamin D is so important, especially as women. It is important for we're in our follicular development appropriate, maturing eggs, which we call oocyte development. It's important for our endometrium. And then in general, it's important for our bones, immune system, and mood. So you really want to get your vitamin D checked at least every single year, especially if you have infertility, if you have a history of bone issues, if you have chronic fatigue, if you have autoimmune disease, if you have Hashimoto's thyroiditis, PCOS, endometriosis, malabsorption, or gut issues. That is a time where you especially need to check your vitamin D even more often than once a year. And then when do we check what's called a 125 vitamin D? So this is something that's checked really, really rarely. So if you have really high calcium and something called a low parathyroid hormone, certain diseases, for example, there's something called sarcoidosis or lymphoma, that can produce excess enzymes, which will cause elevated 125 vitamin D. Or if you have really bad kidney disease, or if you have a rare inherited disorder of your vitamin D metabolism. So it's usually only specialized endocrinologists who will check a 125 vitamin D. So make sure you're checking a 25 OH vitamin D. And then another question that is really common is, should we be doing vitamin K or no vitamin K, right? Do you need vitamin D and vitamin K at the same time, or just vitamin D? So this actually comes from theoretically how vitamin K works. So vitamin D upregulates the proteins that need vitamin K. So basically turns on proteins that use up vitamin K. And those are the proteins that help make bone. So the theory is that if you have vitamin D and you don't have vitamin K, it can't make bone as well. However, in randomized controlled trials, they found no additive benefit of vitamin K because we can get vitamin K from other sources, especially, for example, green leafy vegetables. So I don't think it's very important whether or not your D has vitamin K or not. If you have a D that has vitamin K, great, but I wouldn't specifically seek out a vitamin D that has vitamin K. As long as you're getting some green leafy vegetables and vitamin K foods, then you don't necessarily have to have a vitamin D with a vitamin K. Another question is, should you be doing vitamin D2 or vitamin D3? So D3 is the form that your skin naturally makes when it's exposed to UV sunlight. So D3, remember, that's the inactive one that your body converts into the storage form, which is called 25 OH vitamin D. And that one, D3, is also what's found in our fatty fish. D2 is actually not naturally produced in humans. So you want to take vitamin D3. If you're supplementing, please make sure you're taking vitamin D3. D2 is just easier to produce. So a lot of prescription vitamin Ds are going to be D2, but that's a much, much lower quality vitamin D. And it's not as into D3 raises your blood levels more efficiently. It keeps your vitamin D levels elevated longer because it has a longer half-life, and it's about 1.5 to 3 times more effective than D2. So if you're supplementing or you have prescription vitamin D, make sure it's D3. And then what do you want your levels of vitamin D? Remember, you want your levels of 25 OH vitamin D. What do we want them to be? So for bone disease prevention, you want your vitamin D levels to be 30 milligrams per milliliter or higher. However, for hormone optimization, you actually want your vitamin D to be 50 or higher because there are vitamin receptors in your ovaries and your endometrium. Like we talked about, it helps follicular development, egg maturation, endometrial receptivity, embryo implantation. Because vitamin D is so important for hormone regulation and fertility, we always want it to be 50 So most adults, just because it's so hard to get 20 minutes of midday sun, are going to require 2,000 to 4,000 IUs daily for maintenance. So again, make sure you're doing D3. You're going to need at least 2,000 to 4,000 IUs daily just for maintenance to keep our vitamin D levels maintained. If your levels are 20 to 30, you're going to need at least 5,000 units a day. And if your levels are less than 20, you're going to need at least 10,000 units a day. So it is possible to overdose on vitamin D. So vitamin D is fat soluble. It's not water soluble, which means we hold on to it and we don't necessarily pee off any extra like water soluble vitamins. So you have to be careful. You don't want to go on really, really high doses of vitamin D for long periods of time. If you're on a really high dose, you need to be checking your levels frequently to make sure you're not overdosing your vitamin D. And if you're taking a dose that's higher than 4,000 units, you're going to want to get your vitamin D checked at least every 3 to 6 months just to make sure it's not going too high, right? We want to hit a sweet spot where we're not too high, where we're holding too much, and then we're not too low so that we're truly supporting our bones, immune system, and reproductive system. And then how is it that we improve absorption? So there's 2 things that really help the absorption of vitamin D, and that is fat and magnesium. So you actually want to take vitamin D in a perfect world with a meal, not on an empty stomach, and you want to take it with a meal containing fat. Also, if you've never had your magnesium levels checked, you also want to check your magnesium because in order to absorb, vitamin D actually needs magnesium. So if your magnesium is low, you're going to want to take magnesium with your vitamin D. So in summary, what we want to take away is there are 2 types of vitamin D that we're measuring in our blood. So if you're getting your blood levels checked, you want to do 25 OH vitamin D. And then you want to shoot for a level that's 50 or higher. And if you're supplementing, you want to supplement with vitamin D3. And you want to get your levels checked either 3, 6, or 12 months apart, depending on how low it is. For example, if your vitamin D is really low and you're having to take high doses of vitamin D, you're going to want to get it checked at least every 3 months just to make sure it's increasing like it's supposed to. And there's also vitamin D injections. So here at Vera, we started doing vitamin D injections because a lot of people have significant gut or liver or circulation issues, and sometimes it's not as efficient to take oral vitamin D, and it can be you can get your doses, you can get your vitamin D levels up much faster if you're doing injections. I actually had a patient who is 51 years old. She came to me and she said, Dr. P, I have really, really bad perimenopause symptoms. My hair's falling out. I feel so exhausted all the time. My periods are really irregular. And we did a whole comprehensive test, and her hormones were actually relatively well balanced. She was in perimenopause, but she didn't have a really severe hormone dysfunction. But it turned out that her vitamin D was 9. It was extremely low. So she was extremely vitamin D deficient, and she was also extremely iron deficient. So we started her on oral vitamin D, and we gave her a vitamin D injection, and we started her on iron. And in 2 months, she came to me and she said, oh my gosh, Dr. P, this whole time I thought that. She said, oh my gosh, this whole time I thought that it was my hormones that were off and that I was feeling terrible because into hormones, and I came to you to try to have a discussion about whether or not I should start hormone replacement therapy or estrogen, and it turns out I'm just really depleted in my vitamins and my nutrients. So once we got her vitamin D and her iron up, she said, Dr. P, I feel amazing. I have so much more energy. My mood is great. My periods are regulated, and I don't have any perimenopause symptoms anymore, and I don't even need to be started on hormones. So that just goes to show the power of vitamin D. It can literally help you regulate your cycles and help your mood, your brain fog. So it's very important for a comprehensive evaluation that you not just get your hormones checked, but you also get your nutrients checked. So she didn't even need to go on hormones. She just needed some vitamin D and some iron, and she felt amazing. And she said, Dr. P, I love you, but I don't need you, which is exactly our goal, that we do a good, comprehensive deep dive, figure out what's going on, figure out what you need, measure it, make sure it's going up, make sure you're feeling better. So if your homework this week is go to your doctor, check your vitamin D levels. If you are in childbearing age, you definitely want your vitamin D levels to at least be above 50. And then I want you to check your number and make sure they measure the right one. Make sure they measure 25 OH vitamin D. And then I want you to check your vitamin D supplement and make sure it's vitamin D3. So that's your homework for the week. If you have any questions, don't hesitate to reach out. Our Instagram is @Vera Fertility. We are so thrilled that you joined us today on this episode of the Hormone Café, and we look forward to the next episode.